Hello, everybody. Thank you so much for coming to this channel and finding this video. I promise you that by this end of this video, you will know everything that has to do with anemia. I am going to discuss how to take the case history, but more importantly, cover every single symptoms you need to know to be foolproof in this anemia. So let's begin. Now, let's start with the symptomology. I'm very sure that most of you know how to take a simple case report. If not, that is okay. We will cover that in another video. Now, let's start with symptomology. If a patient comes with fatigue, tiredness, lassitude, and generalized muscle pain, that means this is the earliest symptom of anemia. The earliest symptom of anemia is fatigue, tiredness, lassitude, generalized muscle weakness. Next, you need to know that the symptoms related to CVS will be dyspnea on exertion. On exerting, they will get dyspnea. They will get palpitations. They will get angina pectoris. When we have to talk about CNS symptoms, they're going to get faintness. They're going to faint. They're going to have giddiness, headache, and they will hear some sounds like roaring and banging. They can hear tinnitus, that is the roaring and banging sounds. They can see spots in front of their eyes. They can have lacking concentration. They can be drowsy. And if the anemia becomes very severe, then our patients can have clouding of their consciousness. They will have numbness, cold, feeling of cold, and they will have tingling at their hands and feet. So these are the CNS symptoms. What about menstrual symptoms? Menstrual symptoms, amenorrhea, menorrhagia. These are the reasons. Amenorrhea and menorrhagia. They can cause anemia. What about gastrointestinal tract related? They can have decreased appetite. Some of them can even be anorexic. They can have flatulence, nausea, constipation, distension, and pain in the abdomen. Some of them can have prolonged fever because the immune system is affected due to the anemia. Tongue, burning and soreness. Pica symptoms. Dysphagia, which we will talk in detail, that is Plummer-Vinson syndrome. They can have jaundice due to hemolytic anemia. Also, they can have bleeding manifestations, that is, if it is associated with leukemia and thrombocytopenia, which we can call it as pancytopenia. Now, let's discuss how to analyze the symptom. Let's analyze what we can do for these patients. So first elaborate on the above symptom, inquiring about the present onset duration, the progression and the associated symptoms. The symptom due to anemia depends partly on the severity and partly on how rapidly the anemia develops. Some hemolytic anemia due to RBC's defects can present very early in life. So apart from this, there are some presenting symptoms we need to inquire about. Blood loss. So blood loss we can see in hematemesis, menorrhagia, metrorrhagia, epistaxis, hematuria, hemoptysis. Do they have trauma? Are they passing worms in the stool? Do they have peptic ulcer disease? Do they have EC bruisability? EC bruisability, prolonged bleeding after trivial injuries. Do they have history of appetite, reduced appetite, and are they losing weight? Do they have the GI symptoms, that is dysphagia, regurgitations, dyspepsia, that is the upper GIT. Dysphagia, regurgitations, and dyspepsia. Can they have something below, that is diarrhea, constipation, abdomen pain? Do they have do they have jaundice? Do they have other manifestations? See, there can be distant manifestations like bone pain, arthritis, and arthalgia. Okay, so don't be surprised. A lot of patients with anemia, there is a link. Okay, what about fever and night sweats? You can link it to tuberculosis, you can link it to anemia, you can link it to cancer. So a lot of like cancers and type B symptoms. Okay, so history of exposure to metal dust, solvent fumes, lead. So you should look for the occupation or where they stay. History of ingesting caustic materials. History of any liver problems. History of exacerbation of any symptoms. Like, for example, they have paroxysmal cold hemoglobinuria. So, paroxysmal cold hemoglobinuria is precipitated in cold temperature. Do they have paresthesia while walking? So, look for these symptoms. So, these are the symptoms you should look in your history of presenting illness. So, as usual, how we write a history of presenting illness: sudden onset, gradual onset, the progression, the aggravated factors, relieving factors. So, write the chief complaints, go with associated symptoms and cover these. Okay, now let's go to the past history. Past history, I will look for, is there any abdomen pain? Is there any abdomen pain? Do they have jaundice? Do they have bleeding manifestations in the past? Did they have blood transfusions in the past? And are they on any medications in the past, like chloramphenicol? Okay, chloramphenicol, alkylating agents, anticonvulsants, oral contraceptive pills. Are they exposed to radiation that can affect the bone marrow? Are they having history of previous anemia? Very important. If they have, when was it diagnosed? What was the treatment? And how was the response to this treatment? The response is very important. Coming to family history, do they have similar complaints in the families? Do they have recurrent jaundice? Okay. Intrauterine infections. Is there any childhood death? What is the cause for it? Now coming to personal history. In personal history, diet is very important. We need to see why, what kind of diet, is it vegetarian or mixed, and what are the diet constituents? Some diets can reduce the absorption of iron. Appetite, is it reduced? Sleep, is it disturbed? If it is yes, what is the cause for it? What about alcohol, smoking, bladder movements? If it is alcohol, the quantity of alcohol. So after this, if it is a female, I forgot about menstrual history. Menstrual history, so age of the menarche. What is the frequency of the cycles? What is the duration of the flow? How many number of sanitation pads are they using? Usually it will be 3 to 4. Is there any clots? Is there history of dysmenorrhea? Do they feel tiredness when they are having their menses? So coming to general physical examination, you will do a complete physical examination. You will look into the build and nutrition. You will look into the pallor, icterus, fetal edema. Do they have koilonychia? So these are your important positive findings. You'll check the vitals and then you'll do your head-to-toe examination. So in the skin, do I see petechiae? Do I see ecchymosis? Any scratch marks? And the reasons for it. Nails, do I see brittleness? Is it brittle? Do I see pallor? Do I see koilonychia? Do I see longitudinal ridging? These all are anemia features. Conjunctiva and sclera. So conjunctiva, sclera, Do I see icterus? Or do I see any hemorrhage? What about mouth? Is there any pigmentation? I will look in the mouth for circumoral pigmentation. Mucous membrane, similarly, pigmentations. Gums, is there any bleeding? Is there any bleeding hypertrophy? And tongue, do I see redness? That's angry tongue, redness. Or do I see atrophy of the papilla? So we will look for all this. Atrophy of the papilla. Now, systemic examination. So in systemic examination, it depends. If I'm looking per abdomen, I'd be more interested in hepatomegaly, splenomegaly, tenderness, mass ascites, history of previous surgeries, and their marks. If it is regarding the cardiovascular system, so I will look for the blood pressure. I will describe about the cervical venous hum. I look for the pulse. Anemia can cause high output cardiac failure. So I will look for hyperdynamic precordium. Okay, how is the S1? Is it loud? Is there any other murmurs? Always remember severe anemia. It can lead to an ejection systolic murmur. Okay, ejection systolic murmur, and you will hear this in the pulmonic area because the pulmonic valve is more superficial of the heart. You will look for signs for cardiac failure, cardiac dilation. Coming to respiratory system. So respiratory system, you will look for crepitations. You will see if there is any crepitations causing pulmonary edema, heart failure causing again pulmonary edema, chronic lung diseases. They can also cause anemia. You will look for your central nervous system. Central nervous system, my focus is on peripheral neuritis. And some patients, very severe cases, sub acute combined degeneration of the spinal cord. You can also go with per rectal examination. So per rectal examination, we can see for bleeding causes, that is hemorrhoids, carcinoma of rectum, or many causes. What about tourniquet? Tourniquet test. Tourniquet test is a test I can use to find bleeding tendencies. Now, how to do it? You will tie the cuff of the sphygmomanometer to the patient's arm and you find the systole. Now, you will increase the systole above systole by 20 to 40 millimeters of mercury. And if the patient suffers any bleeding diastasis, then definitely you're going to see some findings. That is petechiae hemorrhages at the distal part of the limb with respect to the cuff. So you'll see some petechiae. Now, what is anemia? Someone asked the definition. It is a state of reduced oxygen carrying capacity of the blood, either due to decreased hemoglobin or due to decreased red cell count, or both for that particular age, gender, and race. So that is the definition. Now you need to know it because some teachers they need definitions. So what is it? It's a state of reduced oxygen carrying capacity. It is due to decreased hemoglobin, or it can be due to decreased RBC count, or it can be due to both for the particular age, gender, and race. Now, normal RBC's values, RBC again, men, female, male, female different. 5.5 plus or minus 1, 4.8 plus or minus 1. Some people say 4.5. So this in the power of 10 in the power of 12 per liter. So what about for hemoglobin? Again, male, female, different. 15.5 plus or minus 2.5. For women, it is 14 plus or minus 2.5 gram per deciliter. Then packed, packed cell volume, again, it is variable. Packed cell volume can be for male and for female. For male, it is 0.47 plus or minus 0.07. And for women, it is 0.42 plus or minus 0.05. These are not important. It varies on the system. It varies on which device is using to process the blood. They will have their own reference range, but always use the standard reference numbers which keep changing based on your textbook. Then there is MCV, MCH, MCHC, which go with your textbook. Reticulocyte 0.2 to 2%. Now, how to arrive in the final diagnosis? This is place where we are going to integrate every single sub symptoms that we have discussed so far. If a patient has pallor with koilonicia, it is iron deficiency anemia. Okay. What about if it is pallor with icterus? If it is pallor with icterus, it is hemolytic. What if it is pallor with hepatosplenomegaly? It is myelodysplasia. What if it is pallor with splenomegaly? It is malaria. What if it is a case of severe anemia? Patient for the past 2 weeks, anemia symptoms, and her values are something like 6, 5, but there is no hepatosplenomegaly. I will think for such scenarios, possibly it's aplastic anemia. And what if the patient has the circumoral or oral mucous membrane or the knuckles, where knuckles in the fingers pigmentations? So then I will think of megaloblastic anemia, soreness in the tongue, angular stomatitis, or bald tongue, that is iron deficiency. We can also see similar overlapping findings in B12 deficiency as well. Then paresthesia numbness, and numbness is again B12 deficiency. Pallor associated with bleeding tendencies, bleeding tendencies, bone pain, very important, bone pain, okay, with bleeding tendency. That means there can be a leukemia for this scenario, or there can be a thrombocytopenia. And we should look for the causes. There are several causes. When it is pregnant women, it is obvious it is iron deficiency. If a patient has pallor with pedal edema, then I need to think about liver causes. Okay, because pedal edema and with ascites, definitely. Then there will be anemia with hypoproteinemia. Anemia with hypoproteinemia. I'd like to end this case with the final discussion of the favorite tide, that is Plummer Vincent syndrome. And this is occurring due to a long-standing iron deficiency. Okay, you will see the symptoms of iron deficiency. You will also see glossitis and koilonychia. And then you will see post-cricoid web, and this post-cricoid web is going to cause dysphagia. So iron deficiency, glossitis. Sometimes they don't mention glossitis, but koilonychia for sure, and post-cricoid webs. So these integration will help you to handle all the questions that is left to you. Please cover this simple understanding, watch this video 3 times, and then attend your patient. I'm very sure it will make a positive difference in your history taking. All the best for your exams.